Hi, this is Dr. Elahi, and I wanted to briefly discuss a very common and devastating condition, and that is chronic pain. Chronic pain is now a full-blown pandemic affecting millions of patients around the world, including the United States. And unfortunately, the conventional wisdom in medicine has not been able to adequately address this issue. So chronic pain may be related to prior trauma, for example, traumatic injuries to the spine or other. It could be related to neuropathic conditions such as peripheral neuropathy. It could be related to stroke. It could be related to structural disease of the spine, for example, are very common. And traditionally, after the patient is diagnosed, they are given painkillers for the most part. Sometimes they're given epidural steroid injections to reduce the inflammation within the spine, and at times they are given various different medicines ranging from anti-inflammatories such as your common ibuprofen to more potent corticosteroids, and sometimes they're given antidepressant class medications in the hopes of reducing pain. Unfortunately, in many cases, the side effects and risks of those medications far outweigh the benefits, and the patient is left with this chronic issue. In addition to that, the use of opiates, medicines such as oxycodone, Vicodin, Norco, brings on a whole different devastation, and that is tolerance, addiction, and cognitive decline simply due to the use of opiates. So we have learned that there are many other methods that are emerging for treatment of chronic pain that are far more effective and less dangerous. But many patients are frustrated because no one can tell them exactly why the pain is still there. The discs in the spine have been fixed, the corticosteroids have been given, and they have some temporary relief, but the pain continues. So I'd like to briefly discuss the idea of central sensitization syndrome, and it's a very interesting topic. I'm just going to briefly discuss it, and that is pain is far more complex. It is beyond just injury to the hardware of the body. And so briefly, all the nerve signals coming from the arms, legs, spine travel through certain columns in the spinal canal, and they get distributed to various areas, namely the somatosensory cortex, but they also are directed to areas that control emotion, into temporal cortex, areas that control executive function, planning and staging in the prefrontal cortex. And what often happens is, even though the injury has been repaired, there is still excitation of neurons, abnormal excitation of neurons within the somatosensory cortex. That is the area that gets pure sensory information. And it's misjudged as being still inflamed by the prefrontal cortex. In addition, due to the abnormal signaling in these two regions, there is abnormal excitation of the temporal cortex and deeper structures of the brain that increase the fight or flight hormones, releasing a lot of the excitatory chemicals that increase pain. And so the patient is left with this chronic pain condition without a clear cause. So what we've learned is that through techniques such as neurofeedback, which is a training strategy, and through techniques such as, again, transcranial magnetic stimulation, we can rewire these regions so that they are not as inflamed or excitatory as you would see otherwise. And we see this in trials that have been done with TMS, trials that have been done with neurofeedback, and other signaling devices such as pulsed electromagnetic fields that alter in very small amounts the abnormal excitation of these regions, and thereby reducing the pain and suffering without the use of narcotics and anti-inflammatories. Feel free to explore more on our website. That's neurospabrain.com, and send me any questions, and I'll be happy to address those. Thank you.